So yeah, I'll just be very briefly going to talk to you about patient involvement in both the RA case studies that we have heard of today. Before I'll be handing over to Eva, who can tell you much more what it is like to be a patient research partner and how, what the kind of things that she and others have been involved in. Could we advance to the next slide, please? So I'll start off with giving you a little bit of a flavor for the patient involvement in Karen, in the study that Karen has just described to us, the preferences for second-line RA treatment. In her study, she worked together with two Swedish patient research partners, both of whom have got rheumatoid arthritis. And they were involved in a selection and description of the treatment attributes and levels, the factors that affect the choices, preferences for treatment. The meetings to validate the selection of these attributes, the development of the educational material used in the survey, as well as the pre-testing of the survey, so the pilot of the survey, and analysis and interpretation of the results of the various phases of the study. Next slide, please. Then there's also been patient involvement in the preferences for treatments to prevent RA, the study that Maria's just described to us. And in this study, we worked together with 8 patient research partners from the UK, Germany, Netherlands, and Sweden, all have RA. So a truly international team of patient research partners reflecting the international nature of our study. And they were involved in the development of the clinical aims of the case study. So we go way back with patient involvement. So the first aspects of the study, the clinical aims, were developed together with patient research partners. They're also involved in the design and the content of the questions for the focus group schedule, so the qualitative study that Marie mentions, the analysis and interpretation, as well as the write-up of these focus group results. They also advised us on how to recruit first-degree relatives to the studies, and they also voiced some ethical concerns in relation to this, which we were able to address. And then the selection and description of the treatment attributes, very much like in Karen's study, and then the survey content, so how everything was presented, as well as what kind of information about rheumatoid arthritis, for example, to convey. The pre-testing of the survey, again, like a pilot, but then also they have been involved in tasks such as giving feedback on presentation slides for this presentation, but also other presentations we've given in the past. There are co-authors on the lay summary that I've been told is very recently being published, and some of them have been involved in writing of preferred recommendations, or are currently involved. And next slide, please. So I would like to hand over to Eva, who's going to be able to give you a much better idea of what patient involvement actually is, and talk a little bit about her experiences. So I'm going to stop my video now and hand over to you, Eva.
Thank you, Gwenda. So hi, everyone. I'm a patient research partner from the Swedish Rheumatism Association, and I have 30 years of lived experience with RA. I work with the Birmingham team, and I had the pleasure of working with Karim and Marie and Gwenda in Euroteam in 2013. And the preferred PRPs, Dice Gingle and Sue Thomas, were also part of Euroteam. And I'm currently working with PRPs Margot Bakish, Tom Esterine, and Ruth Williams in another IMI project called Are the Cure. So this slide then, what would a study on patient preference be without the input from patient representatives? The input from patient research partners takes many forms. We ask questions. We take part in discussions. These questions often lead to discussions. Give feedback on texts and presentations. We analyze and sometimes challenge interpretations of data and also co-write both academic and lay texts. Next slide, please, Julia. So these are 3 examples from Gwenda's list. And in the focus groups and interviews, we gave feedback on and took part in discussions of the focus group scenarios and questions, the information and the setup of the focus groups. We gave insights in how to describe RA to a healthy person. We provided our views on ranking treatment factors. We provided feedback on the collected data by giving a patient angle on the analysis and interpretation of quotes, and challenged some choices of content and categories. Discussion of the focus group data also resulted in the risk stipulation being changed from 40% to 60% risk of developing RA for the survey. Next slide, please. So in the survey, the discussions on the content of the survey started very early during the focus group stage already. And we gave feedback on content, structure, questions, phrasing and language of the survey, as well as tested it online. And then the last point, number 3, the lay summary, the recommendations, prefers recommendations. We worked on chapter 4 and the paper of qualitative data. The feedback was given on content and how to present results, as well as on all the aspects of text and writing, at times merging into co-writing. Thank you.